Hello and welcome to Module J, which is a lecture on nutrition and fluids. Today we are going to talk about nutrition and fluid requirements for the older adult, make sure that we understand and can identify basic nutrients. We're also going to review over the USDA My Plate. We're going to identify special diet orders that some of our patients or residents may be on related to a particular illness or condition. And we're going to talk about our job as nurse aides and our responsibilities as they relate to dysphagia, aspiration, hydration and dehydration, and our role in enteral and parenteral nutrition. And we'll define those as we go. Some important terms to understand right from the get-go here. Nutrition is when the body takes in and uses food and fluids to maintain health. Nutrients are substances that are found in food and fluids that are used by our body for growth and maintenance. Malnutrition is the lack of a proper nutrition, and this can be due to poor intake, improper diet, or our body's inability to use that nutrition appropriately. So why is good nutrition important? Well, it promotes both physical and mental health. It increases our resistance to illness, produces energy and vitality. It helps us to sleep and feel better and avoid certain common diseases such as diabetes type 2, heart disease, high blood pressure, obesity, some cancers, and osteoporosis, just to name a few. Characteristics of an individual who has good nutrition: a healthy body, and that's well developed, the appropriate weight, alert facial expressions, our hair, our skin, our eyes will appear healthy and bright, a good appetite, regular elimination patterns, and restful sleep. When someone has poor nutrition, some of the characteristics we might observe is fluctuations and changes in weight. Hair, eyes, and skin may appear dull, irregular elimination patterns, poor sleep, feeling fatigued or tired, and abnormal conditions such as anemia or osteoporosis. Now, the nutrients we want to focus on here, we've got 6 nutrients: water, fats, carbohydrates, protein, vitamins, and minerals. And we're going to talk about each one of these individually. So water, this is the most essential nutrient. We can only survive for a few days without water. It's needed by every single cell in the body, and it's the main part of our blood. Water is important because it helps to move oxygen and nutrients into our cells and remove those waste products out of the cells. It helps with digestion and absorption of our food, and it helps to maintain our body temperature through perspiration. Fats are a good source of energy. They also, of course, give some flavor to our food. It's important to remember to teach our residents and patients that certain fats, though, may increase cholesterol levels and lead to heart disease. So we want to make smart choices when we're talking about some of these various nutrients, like the fats, the carbohydrates, the calories. So a good fat example would be an avocado, right? Avocados are high in fat, but it's a good fat that really gives us a lot of energy and doesn't tend to increase those cholesterol levels. Carbohydrates. These also supply us energy, and they help our body to use the fats that we take in. Certain carbohydrates also help or add fiber to our diets, which helps with regular elimination. We can get carbohydrates from a variety of sources as well: breads, fruits, soft drinks, candy. So again, when we're educating ourselves and our patients and residents on choosing good carbohydrates, we want to encourage things like whole grain breads, fruits, things like sweet potatoes versus sugary soft drinks, candy, refined grains, and we'll talk a little bit more about that later as well. Protein. Protein is really important. It's needed by every single cell to help grow new tissue and help with tissue repair. We can get protein from a variety of sources. We've got meats, cheese, beans, nuts, tofu. There's a lot of ways that we can get protein into our diet. Vitamins and minerals. Both vitamins and minerals help our body to function normally. We get the majority of our vitamins and minerals from the foods we eat. Some common examples: vitamin A, vitamin C. Of course, when you're not feeling well or trying to fight off an illness, we try and up that vitamin C a bit. Minerals can be really important. again, of course, to help our body function normally, but some examples, calcium, of course, helps to keep our bones and teeth strong. Iron, we need that to carry oxygen to all parts of our body. So if you're not a label reader, and I'm talking about the nutrition labels, okay, it's important to get familiar with your nutrition labels and to educate our patients to start becoming label readers. This is going to give us a wealth of knowledge when we're trying to make smarter food choices. One of the pieces of information that you see on a label, a nutrition label, is serving size and amount of serving in one package, okay? So what's important to remember, and I'll go to the next slide to show you this. If it pops up, there we go. So here's an example of a nutrition label. So if you look at this, it says total fat, for example, is 12 grams. Now that is the amount of fat in one serving of whatever's in this package. But what I need to pay attention to is that in this package, there's a total of 2 servings. So be careful, because if I eat the entire package, I now have to double that total fat. So eating the entire package, I have consumed 24 grams of fat in one helping. Okay, not a lot of people necessarily pay attention to this or realize that they've purchased something or eating something with multiple servings in one bag or package or drink. One way that's really helpful to measure serving size, because we don't always purchase our stuff with a label on it, is weighing food. Okay, and there's a couple different ways. We're going to talk about weighing food, using our hand as a frame of reference, or using common objects to help us measure serving size. Not everyone's going to spend the time weighing food. Certain people who are on really restrictive diets for whatever reason, or having to really watch what they're consuming, may for a time period need to weigh their food. The hand is a really common frame of reference. And then, like I said, another one we'll discuss and give some examples of is some common objects. Let's first give some examples of using the hand as a reference for serving size. In general, our hand, if you're looking at the palm of your hand, that's about a serving size of things like meat, poultry, or fish. A handful is about a serving size of things like nuts or raisins or a small candy. If we want to know what one serving size, of something like rice or fruit or pasta, that's the size of our fist. Things like chips or popcorn or pretzels, about 2 handfuls, or let me see how they describe it there. Yeah, 2 handfuls, that's about 1 ounce or 1 serving size of those items. Now these might surprise you. So a serving size of something like peanut butter or hard cheese is going to be about the size of your thumb. And something like butter or sugar or some sort of cooking oil, a teaspoon, that's about the tip of your thumb. So it seems really tiny, right? You may find that shocks a lot of people. Now let's give me some examples of common objects. Here they use a deck of cards. That's a good way to look at about 1 serving of meat, poultry, or fish. Something like rice or fruit or pasta, about the size of a baseball. One serving of fruit, about the size of a tennis ball. Butter, mayo, oil, about the size of a postage stamp. So you can see that people can use a variety of ways to think of serving size, because we all tend to overserve ourselves and do more than a single serving size. And when we adjust from eating more than a serving size and trying to make that smaller, it is an adjustment for our bodies. But this can be really helpful in getting your patients, your residents started on thinking about serving size, and ourselves as well. So calories, want to mention that as well. Calories are also the energy value of a food or beverage. On the nutrition label, it'll show, again, calories for 1 serving, so be aware of how many servings are in a package. And the reason they mention calories here is because a lot of people focus on calories when they're trying to lose weight. And that is really valuable, but keep in mind it's not the only thing we need to look at. We need to look at the fat content and the sugar content as well. Okay, so let's talk about the USDA MyPlate, because this is something else. I'm going to go ahead and tell you now. This is a very basic way to look at your plate and look at what you're consuming and how much of each food group you should be consuming in each sitting. And this is a great tool, especially if you're new to nutrition and thinking about what you're eating, or if your patients are new to nutrition and thinking about what they're eating. Once you get this down and this gets you a great start, then you can start to customize it more for the individual, because we are all so different and we have a lot of different needs. But this is a great starting point. The USDA MyPlate was developed by the U.S. Department of Agriculture. It recommends balancing the intake of healthy food choices and physical activity. And it's designed to help people easily build a healthy plate during mealtime. It shows the amount of each food group that should be on a person's plate during meals. The USDA MyPlate emphasizes vegetables, fruits, whole grains, protein, and low-fat dairy. And it says to think about your plate in halves. Half of your plate should be fruits and veggies. The other half should be whole grains. It advocates choosing water over, juices or sugary drinks like sodas. And you guys may have heard at some point, it's been a while now, but of the My Pyramid. That used to be the USDA's way of showing how we should build our meals. But this is actually, in my opinion, a much more clear illustration. Okay, let me flip to the next page here. All right, so like we said, they suggest making half your plate fruits and veggies. They also recommend choosing vegetables and fruits that are in a variety of colors, because each of those colors, believe it or not, actually provide different things that we need for our body, different nutrients, different vitamins and minerals. So variety is key. They suggest making those grains whole and choosing low-fat or non-fat dairy products and including proteins. Actually, I said half grains. The other half is grains and proteins. My apologies. So half the plate, fruits and veggies, the other half whole grains and proteins. They suggest mixing up those proteins, right? So getting a variety, nuts and seeds, soy products, eggs, lean meats and poultry, seafood and beans. Those are all options to get you that protein. Okay, so forgive me, I'm trying to get back on the slide I'm supposed to be on. Okay, so a few other things to say before I get to this slide. Again, some of these recommendations when we're explaining the MyPlate to our patients: vegetables, eat a variety of colors. Suggest different creative ways to add more fruits and veggies to your meals, because some people just aren't as comfortable eating vegetables, especially, and we can find little ways to introduce these, right? Adding beans or peas to pastas, soups, or salads. Fruit, we can add that to pancakes or on top of cereal in the morning, or maybe to some low-fat yogurt. Grains. Some people don't understand that there's a difference between whole grains and enriched grains, or refined, excuse me. So we can explain those differences. That would be saying, choosing brown rice over white rice, getting oatmeal in the morning, adding fruit to that, right? Dairy, they do recommend choosing the low fat or non-fat, like I have said before. Keep in mind this differs for small children and babies. You can use low-fat yogurt in place of sour cream in so many meals, and it's still really good. Protein, we said get the variety. That's always important. And another thing to tell people about the proteins is do try to choose more lean options. So when you go to the butcher, for example, you can get the ground beef that has the higher fat content, or you can get the kind that's more lean, lower fat content. Encouraging our patients to choose the lower fat content is preferable. So I mentioned that the USDA MyPlate encourages activity as well. Per their recommendations, they say pick activities you like and do each for at least 10 minutes at a time, because every little bit adds up. Adults, they say, should get 2.5 hours or more per week of activity of moderate effort. And that could be something as simple as walking briskly. Well, I say as simple. For some people, that is challenging, especially if they've had certain illnesses, conditions, issues with gait. So walking briskly is an example of a moderate effort activity. Now let's talk about some age-related changes that actually affect our nutrition. Because as we age, we actually need fewer calories. And our vitamin and mineral requirements change. Teeth and dentures could affect our ability to chew. Our saliva, gastric juices, appetite, and thirst all decrease as we age. So it's still important for us to get in enough fluid and food, but people might not feel as thirsty, right? Or not feel as hungry. And we don't have to force them to eat until they're stuffed, but we may need to do smaller meals more often, spread it out a little bit to make sure that our patients are getting what they need. In addition, if our residents are on multiple medications, some medications can really affect how nutrients are absorbed, as well as our appetite sometimes. Because of some of these changes, older adults tend to have more issues with constipation. Because if you think about it, if things are in general are slowing down as we age, if food is going through our system more slowly, if we're potentially not drinking as much, that all leads to constipation and other things as well. Our taste and smell diminish, and then of course, if there's other issues going on, they may need assistance with dining, which can affect our nutrition. If we're really busy and we don't have the time to sit and be as patient as we'd like to with our residents, that can affect how much they're getting in. Now we said the diet card, we were going to talk about that a little bit. The diet card is prepared by the dietary department, and it's always based on a doctor's order. Even if they're on a regular diet with no restrictions at all, it's still a doctor's order. Each resident's meal has its own diet card, and at a minimum, the diet card has to list the resident's room number, the resident's name, and the type of diet that they're on. So as nurse aides, we're often the ones delivering the meal trays. We have to verify that the right resident is receiving the right meal tray with the right diet on it. If I hand a meal tray to Mr. Smith and it says, Mr. Smith, room 303, regular diet, or let me do a different example. Mr. Smith, room 303, and the diet card says he's on a pureed diet, and I look at the plate and I don't see anything on there as pureed. He's got crackers, pasta, etc. Then I need to stop right there and get clarification, because I don't want to cause him to aspirate, choke, and have a lot of problems. So let's talk about some of these diets. The regular diet, this is also, like I mentioned, ordered by the doctor. It's a basic, well-balanced diet without limits or restrictions. Special diets, which you may also be called therapeutic or modified diets, also ordered by the doctor. And then once the doctor orders a special diet, that's going to get the dietitian involved even more closely. They're going to plan this meal and they're going to get input from the resident. Because if I now have restrictions on what I can eat and drink, I need to find things that I'm still going to be interested in, that are still going to be appealing and appetizing to me, so that I know I'm getting the nutrition that I need. Special diets can restrict or totally eliminate certain foods or fluids based on illness, in preparation for procedures, or to meet other nutritional needs, specific nutritional needs, I should say. Something that we want to mention real quick before we talk a little bit more about diets is that cultural preferences can affect our diet or restrictions or what we consume, right? So and we have a couple examples here, several examples here actually. Many Buddhists, for example, are vegetarians, but some may include fish in their diet. Some Christians, mostly Roman Catholics, do not eat meat on Fridays during Lent. Mormons may not drink alcohol, coffee, or tea, or anything with caffeine in it. Many Jewish people follow a kosher process for preparing their food. They may not eat pork, lobster, shrimp, or clams. And kosher food is prepared according to their Jewish dietary law. So in that case, kosher and non-kosher foods cannot come in contact with each other on the same plate. So you may not see that Jewish people will not eat meat on the same day or same meal that they eat dairy products. Some other examples, many Muslims do not eat pork. They may not drink alcohol, and it's important that they reserve, for religious reasons, fasting periods. So we need to be respectful of those religious practices as well. And I mentioned we'd come back to the diets real quick again. So we also may come across an advanced diet or advancing diet. This is when food is gradually and slowly reintroduced to the resident. There can be several reasons for this. It could be a medical condition. They could have had a surgery recently. So they're going to typically start out as NPO or nothing by mouth. The next step would be to introduce ice chips. If they do well with the ice chips, so they don't get any nausea, they keep it down, no vomiting, then we'll progress to clear liquids. If they handle the clear liquids well, we'll go to full liquids, then mechanical soft, and then eventually the goal is to get back to a regular diet. If at any point, and we don't go through these phases fast, so I don't give someone ice chips, you know, and then if they do well, 10 minutes later, give them clear liquids, 10 minutes later, full. It's a process. It takes a little time. We don't want to rush it. And if we were to get to, say, the full liquids, we give those a try and we get some nausea, we may back down to the clear liquids and spend a little more time there before advancing to those full liquids again. All right, so there are some other forms of nourishment that we want to mention, and we said this on the introduction slide, is enteral and parenteral nutrition. So residents who can't eat, and this could be due to illness, surgery, maybe they've had an injury to their face, they may have one of these two forms of nutrition. Enteral nutrition is when a resident is getting fed through a tube that's going into the gastrointestinal or GI tract. Now, this tube can enter through the nose and go directly into the stomach, in which case it's called a nasogastric tube. Or you may see people with a gastrostomy, and that's when the tube goes directly through the abdomen straight into the stomach. As nurse aides, we're not responsible for the care of these tubes, but we do need to keep an eye on a few things. It is vitally, vitally important that we keep the head of bed up on patients who have any kind of tube feed, and it needs to be up at least 75 degrees. If it's any lower than that, we have greatly increased this person's risk of aspirating, which is inhaling things into the lungs, which can cause death or other complications. So if we walk by this room and see the head of bed is down, we need to put their head bed back up and let the nurse know right away. Other things to make note of as nurse aides is be really, really careful when we're caring for these patients not to pull on the tubes and make sure that they look secure. If we notice it's coming a little loose or we're concerned that it has been pulled, we need to notify the nurse immediately. Now, parenteral nutrition. This is our intravenous fluids or IV fluids. This is when the resident gets fed through a vein. Again, the nurse is responsible for the care, but we can be observant of certain things as nurse aides. We want to observe for and report any signs of redness, swelling, or pain at the IV site. If we notice that the bag of fluids is getting low, notify the nurse right away. And of course, be careful with tubing and connections and making sure that we're not pulling it when we're doing our care. Alternative or supplemental feedings. Sometimes these are given to a resident who may need extra protein, extra calories, or extra fluid. For example, if someone has a wound, a big wound, and we're trying to get that to heal, we may be giving them some supplemental feedings of high protein milkshakes or high protein ice cream. This is also ordered by the physician, and it's often served between meals. Our responsibility, of course, is to assist the resident as needed, and of course, we're always maintaining an accurate recording of intake and output. Now, you guys remember OBRA. This is federal law for nursing home residents. OBRA states that in the nursing home or long-term care facility, each person's dietary and nutritional needs have to be met. That's a law. The diet has to be nourishing, well-balanced, and taste good. OBRA also says the food has to be appetizing, smell good, look good, and come in a variety of color and texture. The food needs to be served promptly and at the correct temperature, and foods in the long-term care facility have to be prepared to meet individual needs. OBRA also states that if the resident refuses or does not like what is initially offered, that we have to offer something else. Each person also has to receive at least 3 meals a day with the offer of a bedtime snack, and we have to be able to provide assistive devices and utensils as needed. Now let's review over some of those key terms that we talked about, dysphagia and aspiration. So dysphagia is a difficulty in swallowing. With dysphagia, the big danger is aspiration, which we'll talk about in a second. Many things can cause dysphagia. Illnesses like stroke, weakness on one side, some medicines can cause dysphagia. If someone has problems with their mouth or throat muscles, or problems with their teeth or dentures. There are signs and symptoms that someone may have dysphagia, excuse me. So some signs and symptoms of dysphagia. In general, we see these residents that tend to eat very slowly and they clear their throat frequently. They may also have decreased appetite. You might notice that they avoid certain textured foods. When they're eating and drinking, they may actually vomit or choke, have problems breathing, their eyes are watering. They might have trouble chewing or difficulty swallowing, especially small pieces of food or even their pills. They may even have to swallow several times to get one bite of food down, and they may spit out their food. During meals, and after actually, during and after meals, you may see they're dribbling or drooling food or fluid from their mouth. They may pocket food in their cheeks. Coughing, gurgling when talking, if you hear that, that's a problem. And they may also complain of things like heartburn, the sensation of food getting stuck, or hoarseness after eating. If you see any of these signs and symptoms, this is not something you wait till later to tell your nurse. You tell your nurse about these signs and symptoms immediately. Now, aspiration. If you recall, the definition of an aspiration is the accidental breathing in of food, fluid, vomit, or other objects into the lungs. Aspiration can cause pneumonia or death. Our role is to prevent aspiration from happening. We've mentioned some of these already. We want to make sure that the resident is in an upright position, at least 75 degrees, if not 90, depending on the resident, for eating and drinking, and leaving them in that upright position for at least 30 minutes after to let that food digest fully before we allow them to lay back. We want to feed them slowly. We want to avoid distractions, and that's distractions for ourselves and distraction for the residents. We're going to offer small amounts of food at a time, doing one bite, followed by a sip of water or any liquid, followed by another bite, and repeat. We also want to make sure that the food is swallowed with each bite, that they're not pocketing it in their cheeks. And if someone is paralyzed on one side of their body, we definitely want to make sure that we're putting the food in the non-paralyzed side. If we see signs of gagging, vomiting, clutching their throat, cyanosis, which is when the lips and face may turn a little bit bluish purplish, difficulty breathing, unconsciousness, or complaints of chest pain or tightness, this is an emergency and we're reporting this we're getting help right away. If we're directed to, because someone has dysphagia, we may be ordered to provide thickened liquids, and we do this as directed by the care plan and the nurse. Now, we talked about fluid balance in our Module AA lecture, but we're just going to review a couple things real quick, since we are talking about food and fluid intake. So water, of course, is needed to survive. We know that. We can have death if you get too little or too much water. We take in water with the fluids we drink, of course, but also with the foods we eat. And then we lose water via urine, feces, vomit, sweat, just when we breathe, or if we have any wounds or drains. Fluid balance is needed for good health. The amount of fluid taken in should roughly equal the amount of fluid lost each day. Now, it's worth reminding ourselves about dehydration and the risks of dehydration. If fluid intake is less than fluid output, dehydration is going to occur. The resident who does not take in enough fluid for the body, that's going to cause the tissues to lack water. This can occur with a lot of things, illness. So we have high fevers, vomiting, diarrhea, dementia because they forget to drink, excessive sweating. If someone is on a fluid restriction, and that may be by a doctor's order, but we have to be cautious with those. Our role is to prevent dehydration, right? So make sure that our resident has fresh water every day. Offer assistance if they need it. Measure and record intake and output accurately. If someone has dementia, every time we go in that room to check on them, bring them that water, offer them water. And of course, observe for and report signs and symptoms of potential dehydration. So signs that dehydration is coming, right? That is someone who you know does not drink at least 6 8-ounce glasses of fluids per day. They drink hardly at all or nothing at all during meals. They have trouble swallowing fluids. They have fever, vomiting, or diarrhea. They're confused. They complain of dry mouth or thirst, and if you notice that their urinary output is decreasing. Now, signs and symptoms that dehydration is here. It's already happening. We're dehydrated. Severe thirst, dry mucous membranes, cracked lips, skin will be warm and dry, eyes will appear sunken, constipation, weight loss. Sometimes we get irritable, dizzy, confused, weak, headaches, low blood pressure. And if you're taking vital signs also, well, the low blood pressure, but you may feel an irregular heartbeat and it's going to be rapid and weak. So make sure that we're trying to avoid getting to dehydration in the first place, but make sure that you're reporting all these signs and symptoms of dehydration or potential dehydration, and we're preventing it from happening. Now, of course, the other side of this, and this is the last thing we're going to review for this module, is edema. That's the other side of dehydration, right? This is when fluid intake is greater than fluid output. This is when our tissues swell with water. This can occur in patients who have kidney or heart disease. Our role as nurse aides is making sure if there's any weight orders is to do that per the instructions. Increase pillows if someone needs their head of bed elevated to help with breathing, or elevate an extremity if the swelling is in the extremity. Restrict fluids per the doctor's order, and observe for signs and symptoms of fluid overload. So there are also signs of fluid overload that we need to be watching for. Of course, swelling, right? Shortness of breath, difficulty breathing. Sometimes their abdomen will actually be swollen as well. A lot of coughing, weight gain of 1 to 2 pounds in a day, being excessively fatigued or tired, decrease in urine output, and increase in heart rate.